Remember Obamacare? Well, one of the main goals of the program was to sign up as many young, healthy adults as possible. They were supposed to be Obamacare's saving grace and keep costs down for everybody else. But there are new surveys now showing that this group may not be as invincible as the administration thought and hoped. Here to explain, Vital Springs Technology CEO Dr. Sreedhar Potarazu. Great to have you back, Dr. Sreedhar. This blew me away because these are not Republican talking points here. This doesn't come from the GOP, not at all. In fact, this comes from Kaiser and Blue Cross Blue Shield. Kaiser saying 20% of exchange enrollees describe their health status as fair or poor. Should we be surprised?
No. We should be shocked and alarmed, especially to your point, when you have Kaiser and Blue Cross Blue Shield of North Carolina, which is an extremely proactive insurance carrier, very sophisticated, that is trying to understand what the risk pool looks like because they're so limited in the amount of information they have. And it's important, obviously, in terms of what their premiums are going to be, but it's also important because they might have the opportunity to go back and ask the government for more money in order to cover the losses.
I was so afraid you were going to say that. And here's what Blue Cross Blue Shield that you mentioned is saying about these folks. They have self-reported diseases like diabetes, depression, asthma, on and on it goes.
Sure.
These patients cost 6 times more than the enrollees of similar ages without chronic diseases. So at the end of the day, you may make a great point that they're just going to knock on the door of Washington and say, hey, we need more dough.
Sure, because they set up these things called risk corridors, which means that if they end up having to take on more people who are sick or taking on more risk in this case, then they're going to be backed up by this extra money that has been set aside from a pool that some insurance companies have had to contribute to, but the government doesn't necessarily have that right now. But this whole issue of adverse selection, which is what it's called, when you get the unintended consequences of people ending up in certain plans, is almost a predictable event in terms of what we think is going to happen here. So what the market is going to see between now and 2015, and we're already seeing hints of that, is that premiums are going up.
That's
the rates
right.
are going up in many of the marketplaces.
You are absolutely right about this. But let me get to the absolute outrage in this story, which is that we were promised that if we could sell young people on this Obamacare health care plan, we would bring down costs of the entire program.
Right.
That's not going to happen.
Well, it's interesting you say that because you saw the big campaign and the big pep rally around the numbers that came in around enrollment to say that we now have all of these young people signing up. When we start to now look at the risk pool of the young people that signed up, which is what's now coming out, it's really going to tell the story in terms of how much it's going to cost and whether, in fact, the number of enrollees really covered the cost in terms of leveling out the risk. Because all of the attention...
this is just the promise has not lived up.
That's right.
Reality has not lived up to the promise over and over again.
All of the attention has always been focused on this magic number of we need to get certain number of enrollees in, and that's the wrong number. The right number is what's coming out now of what these people are going to cost.
Dr. Sreedhar, we are running out of time. Thanks for coming on. Great to see you.
Thank you, Jerry. Good to see you as well.